Hi everyone, I'm Jen Huili. Today I will discuss phage therapy and the use of bacteriophage as a technology to fight bacterial infection. Before we focus on phage therapy, let's see what we learned about phage from our lecture. Phage or bacteriophage is a virus that specifically infects bacteria, and it doesn't infect other type of cells. We can see it has capsule head, nucleic acid, sheath, tail fiber, and tail pins. To kill bacteria, phage experience 7 steps: absorption, penetration, duplication, assembly, maturation, lysis, and then release. We call them as a lytic cycle. Now we know phage kill bacteria and won't affect other type of cell. Secondly, before antibiotics were discovered, there were no effective treatment for human bacterial infection. Do they lead you to any speculation? Yes, that's what we discussed today. Phage therapy. In 1919, a microbiologist named Felix de decided to treat a boy who had severe dysentery with a bottle of phage. His symptoms improved immediately and he recovered completely within days. This was the beginning of phage therapy. Eventually, de created 5 different commercial preparations of phage to treat respiratory infections, skin infections, and so on. They were marketed by a company in France, now known as L'Oreal. Phage therapy might be sound new in the USA, but it has been used for 100 years. Advantage include reducing side effects and risk of bacterial developing resistance. Phages are extremely specific and only affect one species of bacteria, leaving normal microbiota alone. Of course, there are disadvantages. The difficulty of finding an effective phage for a particular infection. Because of these advantages, using phage in the Eastern European country is quite common. Currently, major strategies for phage therapy include phage cocktail, phage derived enzyme, phage antibiotic, and phage antibiotics synergy, engineer phage, and the last one, phage and CRISPR. Due to the time limit, today I only introduce phage cocktail. It targets a single or multiple bacterial pathogen and used to treat skin and wound infections against Staphylococcus aureus, E. coli, and some other specific infections. Phage in practice are applied orally, topically on infected wounds, and spread on to surface, or used during surgical procedure. Infection is rarely used. Injection is rarely used, avoiding any risk of trace chemical contaminants. Phage can usually be freeze-dried and turned into pills without material reduced efficiency. Temperature stability up to 55 Celsius degree and shelf life of 14 months have been shown for some type of phage in pill form. Application in liquid form is possible. Store in fridge while clinics generally keep supplies of phage cocktail for the most common bacterial strains in a geographical area. That's why phage cocktail is sold in pharmacies in Eastern European countries. You can see in the right side, this is the cocktail, phage cocktail. However, phage therapy isn't yet approved for people in the USA. There has been experimental phage used in a few rare cases only. Phage therapy is being used in food industry, however. With a rise in antibiotic resistance and a move towards less synthetic forms of medication, studying and manipulating the behavior of phage could advance the medical and pharmaceutical industry. I believe we will have more and more phage therapy treatment in future. These are the reference. That's all. Thank you.